Welcome to today's course, Iodine 101. In this course, I'll share some of the history of iodine and why we fear it in today's culture. I'll also share some information that will help you to understand the benefits of iodine and why you should consider supplementing with it. I'll then guide you through the protocol and point out some things you should do if you decide to embark on this journey. My name is Stephanie Beist, and I'm a naturopath and certified health coach. I've been studying iodine since 2006 when I began using it to assist in my own healing from papillary thyroid cancer. It changed my life so much that I became passionate about sharing it and helping others. Before we begin, I need to share this disclaimer. This presentation is not meant to be medical advice. It's an educational presentation that shares my research and observation from years of teaching others on their individual iodine supplementing journeys. It's not meant to diagnose or prescribe protocols or products. The intended purpose is to introduce you to the potential benefits of supplementing with iodine. Iodine was discovered by Bernard Courtois in 1811. This was 207 years ago. He was a French chemist seeking an alternative to salt pepper, which was in short supply during the war. He extracted sodium and potassium compounds from seaweed ash. Once removed, he added sulfuric acid to it for further processing. He accidentally added too much sulfuric acid, and a violet-colored cloud appeared. The gas condensed on metal objects in the room, which created solid iodine. In 1829, Joseph Lugol created a medical formula called Lugol's formula, which contained iodine and potassium iodide. This was 189 years ago. Lugol's formula was created using both iodine and potassium iodide in milligram amounts. This formula is commonly 2% and 5% solutions. Traditional medicine used a 5% solution, which was 6.25 milligrams per drop. A 2% solution is approximately 2.5 milligrams per drop. The 5% solution contains 5% iodine and 10% potassium iodide mixed in distilled water. There are other iodine formulas that I'm often asked about because individuals want to know if they are okay. Here I am showing you nascent, detoxidine, iosol-2, and automidine. All of these products represent microgram dosages of iodine or iodide. If you're trying to accomplish the benefits that have been shared by the iodine project doctors and those on the iodine groups online, you'll want to use Lugol's formula. It works much better due to the combination of both iodine and iodide and due to its higher milligram amounts. The body needs both forms of iodine, and supplementing with only one form shortchanges it from experiencing the potential benefits. This image shows the various organs and glands in the body and the type of iodine it prefers. Under iodine, we have the ovaries, breast, prostate, pancreas, and stomach. Under iodide, we have the salivary glands, thyroid gland, skin, brain, and spinal fluid. This is why it's critical that both forms are supplied in any product you're supplementing with. It's assumed that the body should be able to convert to alternative forms as needed, but so many individuals have health challenges that prevent them from functioning at optimum levels. It's best not to leave it to chance when you have both forms in a Lugol's formula. Next, we'll look at the symporters by organs. Symporters are the means by which iodine enters into the cell. They can be considered like a pump that pulls iodine from the bloodstream into the cell. Through my research, I was able to determine that these organs have sodium iodine or NIS symporters, with the thyroid and breast having both NIS and pendrin as a means of absorbing iodine. A quick glance at this list will reinforce the knowledge that much more than 150 micrograms is needed to sustain a healthy body. 150 micrograms was determined as the daily amount needed in order to avoid goiter, which shortchanges the rest of the body. Many doctors continue to tell their patients that there's no need to supplement with iodine because they believe that they are getting enough through their diets. But what is that assumption based on? They believe that it's coming from salt that is contained in processed foods. There are two issues with this. One, what if someone eats a whole food diet that contains limited processed foods? We know that the soils are depleted, so the food you eat no longer contains adequate amounts at the bare minimum to overcome goiter. When fully saturated, the body contains 1,500 milligrams and the RDA is 150 micrograms. The second issue is the assumption that food manufacturers are using iodized salt. This is a misnomer. After the widespread fear generated by the Wolff-Chaikoff paper and the dangers over iodine overconsumption, manufacturers started to remove it from their products. I was able to confirm this was true when I was going through a low iodine diet in preparation for my radioactive iodine ablation. I belonged to many thyroid cancer groups whose members were also going through the same protocols, and they called manufacturers to inquire of the iodine content and were told that they no longer used iodized salt. The Wolff-Chaikoff research paper has caused unnecessary hysteria on the part of the medical profession that resulted in them ceasing the recommendation and usage of what was once considered a universal medicine. A saying that was taught to Dr. Abraham in medical school was, "If ye don't know the how or the where, what, and why, prescribe ye then K and I." My research of medical books and publications from the 1700s and 1800s have confirmed the widespread use of iodine in high doses and the amazing effectiveness it had. We've lost this medical practice that helped many to find health and healing. Another huge problem, in addition, is the soy in high volume in our processed foods. It's found as an ingredient called soy lecithin. Soy is a known goitrogen, and goitrogens are things that cause goiter because they block the absorption of iodine. Its name is kind of deceiving in that it perpetuates the misconception that iodine is only needed by the thyroid gland. In fact, when iodine is blocked, it's blocked body-wide. Take a look at the ingredient labels the next time you shop and see how many of them contain soy. The last reason for the deficiency in iodine that we're seeing today is the high level of halide exposure. We're bombarded with bromide through flame retardants and dough conditioners in the form of brominated vegetable oil. We have fluoride in our water and tooth care products, chlorine in our water as well, and in a hot shower we inhale it into our lungs, which enters our bloodstream. This issue is magnified by an iodine deficient status because the body attempts to compensate for the lack of iodine by trying to supplement another halide, which in turn blocks the receptors that would pull iodine into the cell. Iodine was traditionally found in baking products. Potassium iodate was used as a dough conditioner, but in the 1960s it began to disappear from ingredient labels and was replaced with potassium bromate, which ironically is an iodine blocking substance. We not only created a depletion, but added an antagonist. Iodine can still be found in salt products, but as I mentioned previously, it's being used less and less in manufacturing, so even avoiding goiter is getting next to impossible to accomplish without supplementing on purpose. The last source of iodine was through farming. It was added to the feed for the animals as well as being used as a disinfectant tool. Farmers would paint the udder and teats of cows with iodine to cleanse it prior to milking. This caused not only iodine to enter the milk through the milking process, but it was also absorbed by the cow into the udder. It would be interesting to know if the incidence of mastitis is increased in cows now that iodine's been replaced with a chemical disinfectant, since iodine has antibacterial and anti-inflammatory properties. Now that we've discussed why we are deficient, let's discuss why we need and would want to supplement with iodine. I wanted to share a few of the known therapeutic benefits first. Iodine has properties that are antibacterial, anti-cancer, anti-inflammatory, antiparasitic, and antiviral. It can increase the pH level to a more alkaline state, which is good for maintaining health. Disease comes from an acidic body. It's also a mucolytic agent, which helps to cleanse the body. Thank you for viewing this preview of Iodine 101. You can register to view the course in its entirety on Teachable. The link to the course information can be found at steppingstonesliving.com/courses or under the Iodine tab. I also offer an additional course called Getting Help with Iodine. It's a course designed to assist you with the tools to work with your healthcare practitioner in supplementing with iodine. Please check back to this channel in the future. I hope to be offering some more courses that will help you on your iodine supplementation journey. Thank you and have a great day.